Hello, everyone, and welcome back. Something a little bit different today. I just want to show what we can do to kind of make patients' lives and referring dentists' lives a lot better. As you can see, patient walked in, crown was in his hand, not a ton of tooth structure left here either. Most of the buildup had broken off inside the crown itself, so there was no salvaging this as far as putting it back on. As far as whether or not to do the root canal, there was a slight finding there. He needs a post. It's very quick for me to get there and clean it out. And so what I want to talk about is the idea of unreasonable hospitality. Fantastic book if you've never read it before. I will be giving a presentation here shortly on the idea of the unreasonable hospitality. Unfortunately, that has been delayed. Thank you, Johnny. I had to get you one call out. But the idea is that it's very important to give patients and pretty much anyone you interact with the best possible idea of hospitality. So I'm going to show you, without further ado, how we do that in this case. Patient presents like this with a broken off tooth. I still have the crown though, and I know that the dentist he's going to doesn't have a CAD/CAM system, so she's going to have to make this traditionally. And if she has to go in and not have any idea of what the crown looked like, that's going to be a problem, but she also wants me to put a post in there and build it up. So what I ended up doing is taking a triple tray, real quick with the blue bite, take a quick impression here.
A few moments later.
And here we go, and we're ready to pop this off. So as this comes off, you can see it's slightly undercontoured on the buccal there. And so I'm going to add just a little bit here in just 1 second. But what this allows you to do is give the general dentist a very good idea of what the tooth looked like beforehand and give the patient a tooth back. So you'll see here in a second how I do this. I added just a little bit of blue bite here along the buccal to make sure we capture that gingival margin. I ended up liking my final x-ray better, my final shape better than the actual pre-op. I'll show you in a few moments at the end of the video what those two different ones look like. But this just allows you to capture the anatomy. You can see how much of the existing build-up material was inside the crown itself. So without, let's go ahead and start this off. I'm using the prep burr here because the axis was pretty large to begin with, and it was just kind of like that little smush of composite in there, as you saw from the x-ray. So I'm going a little bit more aggressive because it was a large chunk of composite, and I like removing composite with this big prep burr. It just makes it so much easier. After that, use the workhorse burr just to clean up a little bit more, and we've exposed the gutta percha at this point. So we're going to start the retreat process like you normally have seen me do, using the alpha here to remove that gutta percha. I did get a pre-op measurement, and you'll see that come up here because I'm going to be removing this. This was a large shape to begin with, so I'm going to go straight in with the F5 here, and that's why you see me measuring. I am measuring to about millimeter, maybe 2 millimeters short of what that estimated working length was on the cone beam, because I don't really want to send, too much junk flying out the end, but I do want to remove as much of the gutta percha as possible. You'll also notice I'm spinning this thing pretty quickly here, and that's because as it heats up, I'm spinning this at 550. As it heats up, it's going to start to kind of melt the gutta percha and make it a lot easier to grab, and I'll show you how I'm going to do that here in just a second. But that brushing, notice how much I'm bending the file as I'm moving back and forth. And the reason why is once it's all soft, you can use a nice large headstrum, in this case a 50, which was the size of the F5 anyway, and remove everything kind of in one big chunk. So this is a way that you can see it's a very, very clean technique. There's no issues as far as chloroform and all the crap that, associated with that. And we can pretty quickly, this is maybe 2 minutes into the procedure, we have removed the vast majority of the gutta percha, and I think with this last little twist right there, off it comes. Some people asked about how I do my hand filing. In this case, the headstrom itself works by screwing it in. So literally I just righty-tighty, lefty-loosey, screw that thing in and pull. That's a very simple, straightforward answer. I'm also showing the entirety of how I did the working length here, because you'll notice with these large apical sizes, it's a little harder to get stability. So not only did I use the size 50, I'm also rechecking to make sure that I have the exact accurate amount. 18 is our working length, and so I'm going to be going in here. Because this is such a large shape, I will be using a cone for this one for sure. You can see brushing back and forth that makes sure we get anything off of the walls. And at that point, we're done. We're ready to do our final rinse here, so I'm going to use the entire syringe of Triton, get this thing as clean as possible. On a case like this where you just have that, finding, he's never had any pain in this tooth. The root canal was probably 15 years old, but we're going to be putting a post in there anyway, which means if it were to fail, an apico would really be the only option, because I don't like drilling back down through these teeth. You run the risk, especially if you're removing in this case, a post is for sure necessary to help hold everything in place. And if I remove that post, then we're going to be in a lot of trouble in the future trying to get this thing out. So this is why I elected to go forward with it, but not really concerned about a large infection here because he really wasn't having any pain. So after we activate, rinse out that nastiness, dry it. I like to use the microsuction to remove the vast majority of this. And then here's what it looks like. So you can see that is the apex of the tooth. That's one of the cool things with microscopes and larger sizes is that little red dot there, that's the apex of the tooth. We're seeing all the way down to the very tip of this tooth. It is only 18 millimeters long, so it's not like it's a crazy, crazy long tooth here, but that's what we're seeing. That little bit of bleeding is pretty much normal. I'm not concerned about that at all. I'm gonna use the paper points here just to get it extra dry. A few paper points here just to ensure that everything looks great. And then I am going to be using warm vertical for this technique. So this is the sized F5 cone from SS White. When you're doing large sizes like this, you need to keep measuring and keep pushing. You'll see I'm putting a fair amount of force apically on this because when you obturate, you're going to put that same amount of force. You can see all of these are showing long on there. That's still at 19, still pushing down, still dropping down. You can, if you use the yellow, you can actually see where it is. At that point though, we were solid at 18, even with the pressure. Tiny amount of AH+, you do not need a lot to seal this off. And when you go in with the alpha, you don't want to press too hard apically. You actually want to go in and kind of sear laterally. And same thing with the condenser, really light. You just need to just sear this off. This is almost a single cone at this point because you don't want to put a ton of force on here. Isopropyl alcohol to clean it out. You can see the rest of that composite popped out just beautifully. Always lovely when that happens. And looking pretty clean here. So I like to use these Brasseler endosequence posts. This is a very large one here, and you can see even that is kind of flopping around a little bit. But I was happy with this. I did notice a little bit of tissue right there. I'm really pleased with the isolation here, so I quick zapped it there. But it looks great as far as the x-ray, and we're gonna start the buildup process now. So what we're doing here, going through with the disclosing solution. As you can see, a little bit more bacteria than you'd expect, but it has been exposed to the oral environment. The nice part of that blasting solution is it's going to get rid of any of the cement on there as well. Just create a really nice surface for bonding. The other thing you'll notice is I've left the rubber dam in place. And the reason I did that is because it almost forms a nice isolation for me at this point. So I'm not going to be using anything super fancy here besides just the rubber dam. And the reason why is this tooth needs a crown. There's no doubt about this. It just needs to look pretty enough so that it's going to look better than what he came in with. That's what it looks like when it's all nice and dry and ready to seal. Very pleased with that. And so, you know, think about that unreasonable hospitality thing. Not only did we give the general dentist a nice impression to work with, we're also going to give the patient a tooth back. So let's show you how we're going to do that. So as you already saw me do, we started with the prime and bond, go in with the Air & Lease drop co. This is a short video, so I threw it. I don't know what videos people have seen in the past, so I pick and choose which ones stay in there. Anyway, going back in here, we are, by the way, I have an exciting announcement. We are finally through the bottle of clear fills, so I get to try my new ones. I'm very excited about that. So look for that coming up in a new video soon. I'm going to try out both the 2 and 1 bottle systems and see which one I like. So at this point, we're going to seal everything up. I'm just using LuxCore Shade A3. You'll notice that I kept this in here. Sometimes you got to make sure you clean your composite gun here because that was the problem. And when you have it in a large, when you have such a large area, you can actually use a brown tube for this one, which is so much easier to press. LuxCore already flows very nicely. Makes it very easy. Put that little post inside there and then start to build up around the outside. And you can see the rubber dam is my matrix here. This has to last, I think by the time this video comes out, he will already have had the crown. This had to last maybe a week. I also needed to add a little extra composite there. One gun was not quite enough, as you can see, because we are very short of where that incisal edge is going to be. But at this point, while I have it there, I want to start to sculpt it just a little bit. And that's what you see me doing here. I ended up not curing this one in between. Sometimes I'll cure halfway through, sometimes not. I find that if you can add more composite while it's still in the liquid form like this, it seems to adhere to, like it all combines much better. And if you try to do it where you light cure and then fill on top of there, it just doesn't seem to work as well. So anyway, that's what it looks like. So already looks like a nice tooth. First thing as always when prepping teeth is just take it out of the bite just a little bit there, or at least get the incisal edge. I'm just cleaning off a little bit here. We do most of the finishing here inside the actual mouth, but you can see where that transition line is. It looks like one piece of composite, and that's what we want to see here. And then while we're in here, I'll also start to shape the cingulum as well. Do as much of this as possible with rubber dam on, because there's no lips, there's no tongue. You don't have to worry about the patient. Sometimes when you do dry, they will cough a little bit because it does send up dust everywhere. But pop off that rubber dam, and here's what it looks like. So A3 actually is not too bad of a shade. I have found the Occlusal does darken over time a little bit, which is what we're going for here. But like I said, by the time this video comes out, he's already got the crown done. So for a quick and dirty, hey, we just need to get a crown on here, or get him a tooth. I mean, the poor guy walked in with, no tooth whatsoever, and now he's walking out with at least a tooth there. Even if the shade's slightly off, this is still a much better and very cheap way to do it. I didn't have to use any matrix bands. I was going to be doing the post in here anyway for this dentist, so may as well give him something that looks really pretty and nice. One thing to mention is if you are going to be sending him back for a crown, you want to make sure those margins are nice and smooth so the gingiva is healthy. Makes it very easy for the dentist then. As far as the rest of it, pretty much all we're doing here is just finishing up the polishing. I'm not going to go into the full polish on this one like I would for if you've seen any of my BioClear ones. The reason being, this has to last a week. So as long as it looks okay, let's go for that. What we can see here is I'm just kind of adapting those line angles a little bit better. I found that the skinny diamond is a lot better for this. And so that's what I'm doing, is just polishing along there. A little bit of gingival irritation, but that was that spot you saw me earlier zap with the alpha unit, because there's a little bit of gingival overgrowth. That's why we have a little bit of bleeding there, but by the time we're done, it looks good. And then my favorite burr of all time, cute little mosquito burr. This thing is so stinking useful when it comes to shaping anterior teeth. And this isn't really that zoomed in as far as the video. This is about what my eyes see. I like to do a lot of the fine detail work at about 16 times magnification, and that's what you're seeing here. It just really does create beautiful embrasures. One thing I did want to do, though, is take this tooth completely out of the bite. Luxacor is not the strongest material for this sort of thing. It works great under a crown, and I've used it for years. But for being in function like this, just take the tooth out of the bite. Like I said, we scheduled, more reasonable hospitality, we scheduled the crown appointment for the patient while he was waiting there. I think his spouse was there, and so she was able to let us know his availability. And that's just one more of those small little things you can do to make a patient's lives better. Like I said, I'm not going to go through the full Rockstar polish because it only has to last a week. So a quick hit it with a white stone just to get it shiny a little bit and smooth off some of those imperfections. And you'll see here in a minute, I'm really pleased with how this looks. So after we finish up the polishing, we do need to talk about the bite, because anterior teeth are a little bit different in that you have to check all sorts of things. So this is your eccentrics bite right there, and definitely a little bit high right away. I don't have them do any excursives until I get the central bite stable, because if it's high there and you start putting force on it, you can break the tooth. So that's what you're seeing me do there. It looks good. Now we're doing lateral guidance. And once again, if you see a mark on a tooth like this, take it out. Take it out of the bite. It's going to get a new crown done in a week anyway. So it's not like you're going to run into too many issues, but you certainly don't want this thing to break on you. Checking those again. And now we're going to do protrusive. What I've found for patients, the easiest way to tell them how to do that is to say, push your teeth forward like a bulldog, and they usually get that. The other one that I found that's worked is slide your teeth forward like you're about to bite your nails. Sometimes patients get it's a difficult one to sometimes get across to them how to do that. The side to side everybody gets, and up and down obviously. But that's what the final looks like here. Like I said, a little bit shorter, and I think it actually looks better than the initial crown. I'll go back to what it looks like after here. I was able to fill in those black triangles a little bit more. And as you can see from the x-ray, pretty rock solid as far as that seal. I'm really pleased with how this one all turned out, and I think we were able to give that patient that really special feeling, that unreasonable hospitality. As always, thank you so much for watching. If you have any questions, please drop them in a comment below, like and subscribe, and I'll talk to you next time.